Because I know people who have great, amazing diets. In fact, they go out of the way to be pissed off that their diet is perfect, but they're not better. And I go, well, look in the mirror. And sometimes that mirror is a recording, right? Listen to what's going on in here, because if you're doing all the right things physically and not getting better, maybe you're in a repetitive negative loop of self-talk or a repetitive meditation, affirmation, whatever you want to call it. And that's the part of your diet that's off, because we all talk about food so much, but it's mental food as well.
Hello, thank you for tuning into the Natural Health Rising podcast. My name is Rachel Smith. I am a certified functional diagnostic nutrition practitioner, and I've helped hundreds of people naturally reverse symptoms of autoimmune diseases and other health challenges, from digestive issues to hormone imbalances. And in these weekly episodes, you're going to learn from myself and top health experts from around the world about functional medicine and holistic health tips to help you rise to your healthiest, happiest self. On this episode, I have Dr. Tom Moorcroft with me. Dr. Moorcroft, America's Lyme recovery expert and host of the Lyme Insider podcast, treats some of the sickest, most sensitive patients suffering from chronic Lyme, tick-borne co-infections, mold illness, as well as children with infection-induced autoimmune encephalitis, PANS, and PANDAS. He focuses on optimizing the body's self-healing systems in order to achieve optimal health with simple, natural interventions, utilizing more conventional approaches when needed. Each individual is a unique unity of body, mind, and spirit. He is the creator of the Lyme Disease Practitioner Certification and Mentorship Program, where he distills his over 15 years of experience as a chronic disease recovery expert into a unique approach that allows healthcare practitioners to easily and effortlessly excel at treating patients with complex chronic illnesses. Dr. Tom's goal is to empower everyone he works with to get in touch with their inner source of health so that they can experience optimal health. Welcome to the show, Dr. Tom.
Hey, thanks so much for having me. I'm really excited. It's an honor to be here.
Yeah, I'm happy to finally have you on the show. I think I've been hinting at this for like a year or so. So I'm glad
right?
I'm glad that we got it on our crazy schedules. So for listeners who don't know you, can you share a quick story about your journey, your specific journey with Lyme disease, and why you're so passionate about helping others with that now?
Yeah, I mean, it just started out with I went to college to do natural resources, wildlife management, and I just grew up loving the planet, loving being outside, hiking and riding my bike and just exploring nature. And that's when I really felt the most alive. So I went to school to kind of learn more about the planet, kind of wanted to ideally save the planet, and make it sure it was here for another 7 or 14 or many more generations. And then I was like in college and I was learning all this great stuff, but I got frustrated one day because I was like, all these people, we sit down and we talk, and then we go outside and we do this really great stuff, and we come back in the classroom, we talk some more, and then we're going to do another paper and we're going to study it more, and then we're going to talk some more, and then we're going to study some more and talk some more. And I was like, that's not going anywhere. It takes too long. I'm like, who takes action right away if you get them really pumped? And I'm like, kids. So I took this AmeriCorps internship at what's now known as the Carey Institute. It used to be the Institute of Ecosystem Studies. And I got to teach kids about my passion about outside. And I was really living the dream, I was making about $9,000 a year with a little educational stipend, so I could barely live. But I was able to really take care of these kids and really get them stoked about the things that I was stoked about. And then one day my boss comes up and she shakes me. She's like, Tom, what the hell is going on? I was like, what? And she's like, and then when I turned and looked at her, she's like, why are you drooling on yourself? I was like, what? And I was literally sitting in front of a blank computer screen where she had sent me to do a task an hour before. And she found me literally staring at this screen and like I said, drooling. And she was like, I think you need to go see the doctor. And I was like, well, come to think of it, my muscles were hurting, my joints weren't feeling well. And I couldn't think. And then clearly there's something wrong if you sit at the desk and do nothing for an hour when you think you're doing stuff. And so I ended up getting diagnosed with Lyme disease, treated with doxycycline for about 10 days. And 4 of those days I laid on the floor, alternating shakes and chills and all this other jazz. but then I started to feel better, and it was interesting. It was like my dad's doc. I walked in the room. He's like, "Oh, you've got classic Lyme disease. Here's your doxycycline. After 10 days, you'll be good to go." And I was like, "Okay, sure," because we didn't know any different. But what's interesting was I was better, but then over the next 8 years, kind of most of this was in retrospect. I started to have the brain fog, the joint pain, and all that stuff creep back in. And I got diagnosed with depression, and then that stuff, all the meds didn't work, and it didn't make sense. They said, "Oh, you have the bipolar type 2, like all the good doctors and lawyers do," because I was, kind of in medicine at this point. And then eventually I go into my primary after like 4 or 5 years. I'm like, dude, no one has any answers. Every med I've tried, I've done everything they've said, and it's not working. I get worse. And he goes, and I said, "What do you have?" I go, "I have joint pain, brain fog, and fatigue as my primary issues." And he goes, "Oh, I know. You have fibromyalgia syndrome." I was like, "What?" Like, I was like, "Dude, I just told you like this three symptoms." And then you said, "Oh, well, those three, fibromyalgia is just a grab bag bullshit diagnosis for, we don't know why those symptoms are here." So at
Mm-hmm.
that point, I was like, "Oh my God, this is terrible." Like, I was so disgruntled with the system of medicine that I was in and learning, that someone handed me a yoga DVD, and I really took a big deep dive into that. Thankfully, the people that I trained with were not about calisthenics or looking cool with your legs wrapped around your head and all this stuff, but it was more about movement on breath. And so for me, who was an athlete, who lost a lot of that with my illness, being able to take that and bring it back down and learn how to calm my nervous system and really re-embody, get back in my body, allowed me to heal physically and mentally and emotionally, and probably most importantly, spiritually. And after about 2 years of working on that kind of stuff, my body told me to change my diet and all this. I was about 70% better. I did need to go see some doctors, um, to help me get that other 30% of the way, which, by the way, took another 4 years, but whatever. I'm past that. And along the process, though, I learned that they had missed babesiosis in the beginning. And that was what was really scary, is because that can actually kill you acutely. And this guy just kind of like blase threw some antibiotics at me and threw me out the door. So, but in the end, the great news is it was 12 and a half ish years of struggle. But while we're recording this, it's over 13 years I've had zero symptoms attributed to Lyme or babesiosis. So I know the path of suffering and how hard it is to have someone really listen to you. But I also know that once you find the right people to work with, and like I said, 70% of my healing was what I did myself, then you can get better and you can remain better. And so, that's really, hopefully the message we can talk about is, how do we find out what's wrong? How do we find out how do we get to somebody who can help us? And
Mm-hmm.
then how do we take responsibility for ourselves? And then ultimately, let's get better and go live our amazing lives. So that's the long
Yeah.
and the short of how I got here.
Amazing. And I think just even that story alone is so powerful for anybody listening who probably think that if they've had chronic Lyme and they've been suffering and keep suffering, that, oh, maybe I can't get better. But just hearing that can be super empowering for somebody. And you were mentioning some of your symptoms. So the cognitive stuff, the fatigue, the joint pain, depression, the brain fog. Are there other common symptoms that someone should be looking for if they think maybe I have Lyme disease or some other tick-borne infection?
Yeah, I mean, I think a lot of us kind of are a little more familiar with the kind of the acute Lyme symptoms, kind of that like summer flu situation where it is that muscle aches, joint pain, brain fog, and fatigue. I mean, that's kind of the classic thing. I can't think straight. I have no energy and my body hurts. Um,
Mm-hmm.
so obviously those are things. And now, I mean, it's kind of a challenge. Like a lot of people in the winter are missed for Lyme because they think it's the flu. But now it's like, well, when do you get summer flu? Because I mean, we've got COVID beating people up all kinds of different times of the year. But it's not just all COVID or all Lyme. So we have to kind of be thinking about the basics all the time. And a lot of people will get bitten by a tick in the summer or fall. And you can still get bit any month of the year, but it's definitely more summer into early fall in most areas of the country. So the challenge is it might take 4, 8, even 16 weeks before you, or later, longer before you develop symptoms. So you can develop the symptoms any time of year. So if you're kind of sick, like, Lyme typically doesn't cause like a runny nose and a sore throat. Um, so, I mean, you could start to differentiate. So have it on your radar all year round, but, kind of like your provider should help you ferret that out. Some of the other things that are really interesting in a more chronic state is you're going to start to have some executive function things like so it's not just like brain fog, like you're kind of like this. It's like people who are really high performers might not just go completely like in the beginning for me, it was like I started not being able to do math in my head. And in the beginning, I barely noticed it. It was like, oh, I was trying to do like count change or whatever when we actually used money and stuff. And it was like, but it was like getting slower. And it's like at work, you're not as sharp. You're right. Kids oftentimes will regress behaviorally, socially, or even in memory. So, and like if you watch their penmanship, it'll get like it might have been like, okay, now it's getting worse. There's a lot of behavioral things that can come up. The other thing too is a lot of what I see that gets missed a little. It's not as prominent in adult. Well, in children, we tend to see a lot of food allergies and food sensitivities, almost like leaky gut for no good reason.
Mm-hmm.
Or you've been working on leaky gut with your FDN or your nutritionist or even your osteopathic physician, whomever, and it's not getting better. And you're like, but I've done everything that's right. Well, sometimes those infections can do it. And I've actually seen people with pretty significant food hypersensitivities reverse it just with a proper diagnosis of Lyme and then antibiotics and probiotics. So, um, a lot of GI stuff. When you're adults, it tends to be more like they're getting SIBO, but it doesn't, that small intestinal bacterial overgrowth, but it doesn't quite respond just right, right? You're being sensitive to a lot more things in your environment. It's like all of a sudden you're in 35 and you're starting to get multiple chemical sensitivity that grows over a few years. So it's a lot of these weird things where the immune system is getting hyper triggered almost like it's hyper vigilant because it's starting to feel like more and more, if you're feeling like more and more things in your life are actually kind of like attacking you and your immune system's like, oh my God, like everything could be a bad virus or a bad bacteria. You're starting to go, it doesn't make sense, right? Like I always say, like with food allergies, when people have like more than just a couple, you can't be allergic to everything. You can't be allergic to air. So it's probably something different, right?
Mm-hmm.
So it's a lot of that. There are some cardiovascular things. There's certainly one of Lyme's cousins, Borrelia miyamotoi, can cause hearing loss and
Mm-hmm.
stuff like that. So there's these little things. If you look at some of the co-infections, it's like, babesiosis is like malaria. So it's something that could lead to things like sweats and chills like I had. So if you have a 5 or 6 year old boy who looks like he's in perimenopause, clearly that's not the case. Start to think about some of these other tick-borne illnesses. And then if you get some of the other infections that we often see with Lyme, that depending upon where you're at in the environment, like Bartonella can be transmitted by a tick in Europe. In the United States, it's in ticks in certain areas, but not others. But we see it concurrently at the same time a lot. That can lead to a lot of rage, OCD, acute onset ADHD, babesiosis. Even, if you get really bad anxiety or depression, and it's like doesn't make any sense, it's treatment resistant. Sometimes
Mm-hmm.
that's babesia driving it. And I'm not saying all depression and anxiety or OCD are from these infections, but it should be higher on our list to think about.
Okay. And then what about the big differentiation between joint pain where we have like the migrating joint pain versus a consistent joint pain that might be more like rheumatoid arthritis or something else?
Yeah, I mean, the migratory joint pain is kind of like caused by a couple of things. It's gonococcal arthritis, the variety of different hepatitis you can have. The beauty of both of those kind of general groups they're pretty easy to figure out if you do some blood tests and a really good exam on somebody. And then the other one is Lyme disease. So, when we work people up, I mean, we just try to make sure they don't have those really obvious things. But migratory joint pain is like one of the things that should be a flashing neon sign for Lyme disease. The other thing is, in some of the validated questionnaires, like Dr. Horowitz's, where we've learned more about that, they also talk about migratory peripheral neuropathy or migratory numbness and tingling. Like it's here, then it's there, then it's there, potentially
Mm-hmm.
being associated with Lyme. I see it more associated with Bartonella infections, but like they're so commonly interwoven in a particular individual that if I see migratory neuropathy, I look at Lyme, I look at Bartonella, kind of those things. So any of those kind of migratory things, not a lot of things do that. It's
Hmm.
usually like you get it in one spot. And the other thing is like for me, like I have my right knee was kind of busted up from some hockey and running injuries. Um, and so then when I got Lyme, it was like worse in that knee. So if you have like a compromised area, Lyme loves to go. It's very opportunistic. It's not stupid. It's like, hey, I've been around
Hmm.
for like 13 plus million years. The
Hmm.
oldest human infection is over 5,300 years ago. So as much as Plum Island might have screwed around with it, and it probably did, it's been around forever. That's why it knows how to stick around. But one of those things is it's smart. It just goes to the easy area. So you could have a knee like I had that wasn't really hugely swollen, just a little bit, but it's ultra painful compared to the other joints. And you could have the migration in other areas, but have like an area like, for me, it was kind of like hockey and mountain biking injuries had messed up my right shoulder, and hockey and running messed up or my knee. Something about hockey and me, I don't know. But those are areas that were constantly bothering me, but then the other parts were moving. And
Hmm.
that's just not, so it makes sense that my knee was an area and my shoulder was an area because I had previous athletic injuries, right? You could maybe have early arthritis, but you're not supposed to have pain moving in other places. So that's definitely a good distinction that would make kind of your Lyme spidey sense go off a little bit more.
Okay, perfect. Another big issue is the testing that's being used, and I've definitely talked to a lot of my clients who have came to me, and they said, "Oh yeah, yeah, I tested for Lyme disease. It was negative."
Mhm.
Come to find out later on, we do different testing, and there are some sort of infections there that got missed. So tell the audience more about what are the common tests that are being used if someone's just going to their doctor and asking for a test, and what could be potentially wrong with that.
Yeah, I mean, I think the thing that the starting point is no test is perfect in medicine. I mean, it's just like, especially in the testing with Lyme. So what we do is we have two types of testing, general categories. One is direct, which is meaning we're looking for the organism. The other one is indirect. We're looking for your immune system reaction to the organism. So antibodies, right? So the direct thing with Lyme is if you have a swollen knee and I go in and I pull out the membrane in your knee because it's all it messed up, I have a really high likelihood if you have Lyme disease of finding it there because Lyme's like munching away at it. But the problem is in blood, Lyme is transient in the blood. It moves through the blood, but it's not really a bloodborne pathogen. It's not like something that lives in the blood. So we're likely to miss it there. So because it's so hard to find, and our DNA testing, depending upon what test you use, is 5 to 20% accurate, essentially. Um, it's essentially if it's positive, it's in your blood, it's pretty much 100%. But if it's negative, it doesn't really mean it. It either means you have it, but we didn't find it, or you don't have it, and we can't tell you the difference. So what we use is indirect measures, these antibodies. It's your immune system taking a photograph. It's like, hey, I went to New Mexico. I found some cool cactus. It blooms once every 87 and a half years when the moon is a certain way. I took a picture and then I sent it to you on the phone. I say, hey, Rachel, you should go check this out. It is the most beautiful flower there. And then you go, oh, Tom, that's great. I really want to go see it. Is it still there? And I go, well, I'm not sure because it bloomed, but by the time you get there, it may not be there because I took a picture at a point in time. And this is what antibodies do. So in the beginning, that's the challenge. What our patients are typically getting is what we call a two-tiered antibody test. And that is a screening test called an ELISA or some other form of antibody screen. And it basically is it's a test that says, hey, should I look further? Should I do a more expensive secondary test to confirm it? And then what we say, if it's positive or borderline in the gray zone, equivocal, then we do this follow-up Western blot. And for most labs, a Western blot or a line blot or even an immunoblot all mean the same thing. There's some labs that I'm sure we'll talk about that immunoblotting is a little bit different, but essentially, if you hear the word blot, that's your follow-up test to confirm your first one. So everybody's saying, "Oh, this is so great, this is great," blah blah blah. Problem is, it's it picks up true positives about 56% of the time, and it misses 44% of true positives. So essentially, like if you test 200 people, we're going to miss 88 out of 200 that really have Lyme.
Hmm.
And if we contrast that to like HIV testing, it's so accurate that we miss 1 out of 200 people. So like if I flip that around and I go, hey, HIV, we miss 88 out of 200 true positive people every time we test, there'd be a huge public outcry saying this is completely unacceptable, right? And we would change, we would fix that. And that's kind of what that testing was like back in the day. So we miss a lot. And that's really the big challenge is, and the other problem is with Lyme, as with so many infections, we see that the antibodies go up and down over time naturally. So especially so in the beginning, a lot of times, this is a common thing. You got bit by a tick. You might have even had a rash. You go into the doctor's office and you say, "Hey, I have had this rash for a couple of days." They're like, "Oh, I think it's Lyme. Let me start you on the antibiotic. Let me check your test." The ELISA comes back 2 days later. They say you don't have Lyme. So they take you off the antibiotics. And then you come see me or you a couple of years later when you have fibromyalgia and chronic fatigue because they stopped too soon. So if you order the test too soon, the antibodies can be negative.
Mm-hmm.
And then if you wait too long, they can also be negative if you miss the window. So it's really kind of a crapshoot. And the other problem I just alluded to is the rash. Like if you have the rash, you have Lyme, you don't need to do testing. It's good to double check where things are at and for co-infections. But, that's really the starting point why people get missed is the test is number one, only about a 50-50 roll of the dice. And then number two, people are using it incorrectly. And so that's the two reasons I think that we end up with so much chronic Lyme is that people who were originally almost diagnosed properly, they changed their mind at the last minute because they didn't have confidence in their clinical diagnosis because they didn't understand the lab testing.
Mm-hmm. So for you, how do you go about your figuring that out with your patients if they have it
Yeah.
outside of the rash? Because also we know that the rash is not always there. So that's important.
Right. Well, it's interesting with the rash too. It's like there's so much misinformation or misutilization of really good information. The CDC says that the rash is absent in about 30% of people. So I said, that's really cool. Let's go find out what the medical literature really says. And depending upon what study you read, it ranges between the rash is present in 40 to 60% of people. So I just call it it's about 50% of people. So all of a sudden, like the CDC is minusing out people, in their thing. So everybody's looking for the rash. And then everybody's looking for this classic bullseye rash that looks like these rings of red with clearing, rings of red with clearing. And they say that that's the same as the erythema migrans rash, which is pathognomonic or diagnostic of Lyme. Problem is, of all the EM rashes out there, the bullseye is only about 30% of that. And then there's like purple and red blotches. There's little like weird halo-y things. There's multiple rashes that often get missed and diagnosed as something else when it's actually truly Lyme because they're looking for the ring bullseye when that's only 30% of the 50%. So that's one thing you should look for. Lyme's a clinical diagnosis supported by lab data, right? So one of my mentors told me that over and over and over. So I was like, well, I believe you because I like you and all, but let's go look it up. I looked in Harrison's textbook of internal medicine. It weighs like 25. I mean, it's like you go to the gym with it. It's so heavy, it's like, and I looked it up and it essentially said the same thing. So we need to know if there's Lyme that's more common or less common in our area. We look for the symptoms of Lyme, and then we use our labs to support what we have already diagnosed the patient with, essentially. And this is how most of medicine should be. We've just gotten so reliant on technology, and everybody sues us if we make the wrong, decision based upon not enough good information. And then, so it's like we just, full body CAT scan and MRI for everybody, and it's like really not necessary. If we take a good history, we create a deep relationship with our patient, and we have more than 3.5 minutes to see them, we should be able to come up with a diagnosis. But when it's time to look for that, a lot of our standard labs will do well. Things like anaplasmosis, Rocky Mountain spotted fever, or ehrlichiosis are some of the infections we may look at depending upon where someone lives and what tick they got bit by. Those are great at like Quest and LabCorp or labs like that. But when it comes down to like looking at Lyme, there's a couple of big problems with that test. I already told you why the percentages are not good. But part of that strategy is they're using one strain of Lyme disease to look for all the strains across the country, and that really doesn't work. So some of the labs out there are using more than one strain to get improved sensitivity, right? So, and improved accuracy, essentially. I mean, and so when we do that, then we can strategically use specific Lyme, Babesia, Bartonella testing, and that's where we can start to get higher yields. But again, a lot of times it's like they've been sick for so long. A lot of people are like, oh, I have a 23 band, but not a 39 or a 41. So my doctor said I was negative. I'm like, well, let's see. It looks like a duck. It walks like a duck. It quacks like a duck. And you've got a blood test that says that you're essentially halfway to your blood test being positive, and they say that you don't have it now. So of all my I need 5 criteria, I've got 4, so I just throw it out the window.
Mm-hmm.
So part of it is if you have a good clinical understanding of what's going on with a patient who has exposure history and they have the potential symptoms, then we just go and say, hey, the labs look really damn close. They might not be perfect, but then when we treat them and they start to feel better and their immune system comes back online, because remember that indirect test relies on your immune system being properly functioning. But Lyme lives in by suppressing the immune system. And everybody like talks about immune suppression like it's a steroid. I'm not saying it's like crushing your immune system, but it's dysregulating it. It's making it work wonky. So some things will work really hyper vigilant and other things will be like they're hibernating. And that's the problem with the way all this works. And so Lyme reproduces once every 3 weeks on average in most studies. Strep reproduces 13,000 times in a day. So what we're used to seeing in other infections, just the timeline is so drawn out that we have to really remember not only with treatment and symptom response, but also with our antibodies and testing, we just have to we have this really long timeline. And so, not always do we get everything we want on day 1 with the lab testing.
Okay. Such a good explanation. Are there, so far we've talked about, there seems to be a lot of misconceptions around testing. There's some misconceptions you talked about with symptomology as well, with like the rashes and different things. Are there other misconceptions about Lyme disease that you feel like you would want to clarify for listeners?
There's a couple, and I think the first and most important one is that you can't get better. Right. So, and I know we're going to dive way more into that, but like you can definitely get better. It doesn't, and it doesn't mean that everyone gets 100,000,000% better and is like brand new. But usually what I find is that people understand they can heal. On the far end, they actually come out better than when they started, even if they physically don't cure the disease all the way. But the other parts are like, so many people are like, oh, it's not in our state. Right. I have a colleague who was in Oklahoma. He saw somebody with an erythema migrans rash after a tick bite, and he started treating him for Lyme, and he reported that Lyme was in Oklahoma. And they said, no, Lyme's not in Oklahoma. And he goes, well, the guy actually has his erythema migrans rash. I did the testing. It just so happened because of the timing to be positive. And they're like, nope, there's still no Lyme in Oklahoma. And then the guy goes, oh, well, the guy saved the tick. And we sent the tick off for testing, and it's positive for Borrelia burgdorferi, the bacterium that causes Lyme. And they're like, oh, well, it must have fallen off a songbird. I'm like, well, so how does that mean it's not in Oklahoma?
Yeah.
It just means that it's not all just, hey, the East Coast and the upper Midwest. Habitat changes around the country and global climate change has led to, when I went to school in the University of Vermont, like northern Vermont never had any ticks. There were only a few once in a blue moon in southern Vermont. Now there's ticks that are around every month of the year up into Quebec and everything, like because of the climate change and habitat modification. So there are areas of the country where there's more Lyme, but pretty much every state in the union other than Hawaii has reported cases of Lyme. Now that doesn't so it doesn't mean that where you live has a ton of Lyme compared to like Connecticut or Maine, but it's possible. And so many people travel now, and migratory birds fly. You have to be aware that you can pretty much get it anywhere in the country. And again, not to be freaking out if you're in Oklahoma, it's very uncommon there, but a lot of people travel the Northeast, the Pacific, coast and everything. I mean, these are areas where it's a big deal, the Midwest. So just be aware that this is an important thing, because so many doctors, like, we don't have it here. Like, well, right before the pandemic, we had this thing in Florida where they found this Ehrlichia that was being in ticks, and they're like, I don't know. It's kind of like a mouse Ehrlichia. It's not doing anything. So like, people aren't getting it. And then like the year later, there's a whole bunch of people who died from it. And they're like, oh, right. It's not a human pathogen, but it is. And I actually published on Borrelia miyamotoi around 2014 for the first cases of Borrelia miyamotoi in the country out of the first 26, which were in the first 73 in the entire world. But for 30 years, we told people it wasn't a human pathogen.
Mm-hmm.
Even though it's in the same tick and in the same genus as it's a Borrelia miyamotoi and Borrelia burgdorferi are like genetically almost the same thing. One gets transmitted, the other doesn't. So we went back after we found it was a human pathogen. And within like 18 months of us finding out it, publishing those first 73 cases in the globe, we found another 300 plus cases of people that were stored in the United States at teaching institutions where we said, you look like you have Lyme, but you don't have Lyme, so we're not going to treat you. And oh, lo and behold, it's Borrelia miyamotoi, not Borrelia burgdorferi. So we were close, but no cigar. So we told you you were a psycho and you needed to see the psychiatrist. So there's a lot of stuff coming out. And with all the testing issues, there's so many different strains and new species of Borrelia that cause Lyme disease we're finding around the country that you just have to be aware, right? And it's not to say everything that looks like fibromyalgia is Lyme, but a lot of it is, And so just be aware that the things that are changing on the planet are leading to sort of this march of these pathogens all over. So I think it's that awareness piece. Because the chronic stuff, you got to go see somebody who's a specialist. You got to work with someone like almost like the tag team of you and I, where we've got like the nutrition part, the body, mind, spirit stuff, and we've got the medicine and the herbs and all the personal accountability. But God, you can't get chronic Lyme disease if you've never had Lyme. So let's prevent Lyme when we can, and let's treat acute Lyme and beat the bejesus out of it so that you're not sick for the rest of your life.
Yeah. I actually want to get deeper into the ways that someone can go about approaching chronic Lyme, but if somebody has, let's just do a brief overview. If someone has acute Lyme, what is that window of opportunity that they have to do like an antibiotic treatment? And then at what point does it transition into chronic Lyme? And then we can get into what that looks like.
Yeah. I don't think we know because the best evidence we have is that about 75 to 80% of people, which is consistent between all the new pediatric research, the CDC has been saying forever, almost no matter what you do, they'll get better. But about 20 to 25% of people are going to have symptoms almost no matter what you do in an acute setting. And there's some research that shows that people may get persister forms early from the tick inoculation. So we may not be able to prevent a chronic Lyme in them right off the bat. Then that's not to be scared, but that's just to say that the CDC and the Infectious Disease Society of America, what they're saying may be true, and what ILADS, the International Lyme Associated Diseases Society, and what I'm saying a lot of may also be true. So I think that there's a global truth of like what we're experiencing. The best we know is that the sooner the treatment, the better, right? And I typically say you don't have to go nuts, but you should go longer. So if you have acute Lyme, instead of 3 weeks, why don't we do 6 or 9 weeks, keeping close tabs on you? Why don't we add in maybe an herb or two that are known to go after the persisters just in case it happens? But we may be able to do something like as simple as one antibiotic and a probiotic, as well as like liposomal cryptolepis or just a cryptolepis tincture, like something simple that we know hits all these things, but we don't have to go nuts, but it's early. The problem is I don't know what early really means. I just know that once you've been infected for between 4 and 6 months, 3 months of treatment, at least in a monkey, because we don't have human studies on this, but if we treat you for a month with an IV and 2 months of oral doxycycline, we only cure 27%. So I know that we want to treat you aggressively before 4 months. Right. And what was interesting in those studies was they didn't find the 80-20. Now, they didn't have a ton of monkeys, but like maybe they were finding 27% cure with 3 months of aggressive treatment. So what I'm saying is early on. Now, the other part too is my niece was on minocycline for like over 5 years for acne. Same exact dose I would use for Lyme disease. So why can't, if you think it's Lyme or you got a tick bite, why can't I just treat you for 3 or 6 weeks? Make sure you have a probiotic. Make sure you're keeping tabs on them. I'm not saying over treat people, but but seriously, dermatologists and anybody worried about their skin is throwing these antibiotics around like crazy. Same exact antibiotic. Why don't we just treat you to make sure you don't have a lifelong debilitating disease? Because acne is very uncommonly debilitating. And if anybody has acne, they should just come see you or me and let's fix their gut. And that's a whole nother story.
Yeah. So, okay. So going in straight with the antibiotics and possibly adding in maybe some different herbs and things if that's available to somebody. And once it transitions to chronic or somebody's out there who's been struggling for a long time with this and they're like, I just can't get better. Let's dive into some of those pillars that they're probably missing. Let's talk a little bit about dietary changes. What is the impact that you've seen with diet overcoming Lyme, and what are some steps that people can start taking to improve their nutrition?
Yeah, and one quick, like when you said that, I thought this was really important, is a lot of the resources that you and I put out talk about the herbs, and a lot of the herbs are better than our antibiotics, both for actively growing as well as these persister Lyme forms. So check out some of those resources, because if you don't have a doctor who prescribe for you, there are a handful of herbs, namely Cryptolepis, Japanese knotweed, Chinese skullcap, and potentially adding black walnut hull and or cat's claw that can make a huge difference acutely and chronically when used properly. I'm not saying to go dose yourself nuts, but herbs in general, if you're not allergic to them, tend to be a lot safer, and they have a lot of broad spectrum benefits, and do less damage to your microbiome as we go back to food and diet. So those can be used acutely and chronically. So if you don't have access to them, get started on things like that, if it makes sense. So check out some of the things we have on YouTube and the podcast and all that. From a dietary perspective, I think that, the microbiome is really interesting. I recently did this talk on metabolic endotoxemia, right? Which is a fancy way of saying you get leaky gut and a bunch of crap that's supposed to stay in your gut. All these inflammatory compounds get into your system and they circulate everywhere. So our gut is a primary place of digestion and detoxification. Our gut is a primary organ of immune function. It's right. So something like 70, maybe even 80% of your immune cells at any one time are in your gut wall. You look at where's all our serotonin and our GABA originally come from, like 90+% comes from our gut. So our happy drugs and our calm down and don't be anxious starts from our gut. We have a solar plexus, which is from our diaphragm down, controls our entire nervous system going down. But you all know you have a gut reaction, and that gut reaction works in conjunction with the heart and the brain. And so what's one of the greatest ways to mess up your immune system, detoxification, your mood and everything else? It's to eat crap. There's studies that literally show if you take a mouse and you put it on a mouse diet that would be equivalent to a standard American crap diet, you can actually break down the blood. Well, you'll lead to that leaky gut we talked about. Certain inflammatory compounds go to your brain. They break down the blood-brain barrier and they mess with this thing called the hippocampus. And one of the things that happens is you stop remembering things. They literally have the inability to make new memories, and you have an inability to recall things you just learned. Like the other part is if we wipe out the gut microbiome in a mouse, it will literally sit there in a panic state and not be able to physically move. So think about all of our chronically ill people. We talk a lot about fight, flight, and freeze, where fight or flight are like, I still have the energy to win. I can either fight or I can run away, but I'm going to win. And when they feel like they're backed into a corner and there's no way to win, we shut down, we do this, can't hear what I'm saying. I withdraw and I get in that frozen state. Well, I can do that just by eating crap. Like there's so much science on this. And so one of the things is like I'm always saying, like, you want to become the world's worst bacterial and viral host. Another way to say that is I want to be in the best physical, mental, and emotional state I can be. Number one, so I can love my life and enjoy it. But two, so I'm resilient. I want to build resilience. And one of the best ways to heal yourself and also build resilience and to just feel freaking great is to like take care of your diet, right? So, I mean, there's the obvious stuff. There's so many people talk about it, but it's like, let's get the processed foods out. Let's just sort of start eating more whole food, plant-based diet. I know that you do a whole bunch of work with like AIP and all these other things. There's diets that might be more important for a particular person, at least in my opinion, for a particular person based upon their uniqueness. But the
Hmm.
bottom line is everybody listening knows what, when I say cut the crap out, you know exactly what I'm talking about, right? I mean, it's like kind of like in the supermarket, shop around the outside. I mean, it's like, because all the stuff in a box, it's got 100 ingredients and only one you can understand, which is the last one, which is like sea salt. And they put it on there to get you all excited. Don't eat that shit, just like, but it's like, what I learned when I was healing, Rachel, was I didn't know about diet. Like, we grew up, Coca-Cola was a food group, pizza was a food group. When you start to get stressed, when you're becoming a professional and everything, beer at night's a food group. And it's like, but we kind of knew the beer at night wasn't a food group, but I will admit to that. But the thing was, like, we grew up at a time where people were telling us that that was good. Low fat is good, which is just like one of the most asinine things I've ever seen. Like, fat consumption goes down, diabetes and obesity goes up. It's like,
Hmm.
it's not really rocket science here. Um, you know, but when I look at it, was when I started to truly get back in my body with simple breathing and body movements. Because in the beginning, my 90-minute yoga practice was like 88.5 minutes of breathing, because I could only move my body for about 90 seconds before I was dying. So, but I listened to my body. And this is what I learned through this process, is like truly to listen inside. And as I started to unwind my physical body and follow the breath, which brought my nervous system down, and the beauty of focusing on your breathing and knowing your breathing is happening in your body rather than out there, is it brings you back in your body, which is how you can heal from so many of these traumas. You don't need to relive them. You just need to relearn how to live in your body as your starting point. All of a sudden, my body started to reject the bad foods.
Hmm.
When you're putting shit in your mouth, every time you pick up the effing cigarette, that's not good for you, right? I've never, and it's like all the foods, if you can pick up something with a whole bunch of food dyes in it, a crap ton of artificial sugars, or like a soda or something like that, and you go, wow, this is healthy for me, you're probably not learning to listen to your body just yet. So as you start to get deeper into those practices that allow you to do, I found the diet stuff became easy because it fell away because my body didn't want it. Now, in the beginning, was it harder than later on? Yeah. I mean, I remember when I used to think, oh, I stopped the soda, so I replaced it with like the sparkling mineral water with a little bit
Hmm.
of fruit essence in it. Worked great for me. But then I was like, oh, like every month I'll have a soda. And then it was like every quarter. And I remember when I got to once a year, I always had this anniversary day, where I'd have another soda. And I popped open a Coke and I took a sip and I was like, why the hell am I doing this? It's stupid. And so I haven't had a soda since, and
Yeah.
that's been about 13 years too. So you wonder why. So then the question is, why are people not fully better? We have amazing protocols that kill shit. Right?
Hmm.
They're not all perfect, but the thing is, our body has the ability to heal itself. And I think that that's where we get stuck. And I know this is like a kind of a tangent from the gut and diet, but the thing we learn about our diet is, if we put good foods in and fuel for our body, and we give it the sleep it needs, and we give it the rest and rejuvenation physically, mentally, and emotionally that it needs, it will heal itself. It's programmed to heal itself. And we have to respect that. So as an osteopath, I was trained to give people medicines, herbs, and even foods as catalysts for healing. So when I use an antibiotic, I do not think that that's the only thing doing the healing. It's bringing down the load of infections so that the immune system can rebound and do all the rest of the work. And I've
Hmm.
never spoken to a doctor. I've asked over 100 physicians, when you treat somebody with pneumonia, does the antibiotic sterilize their lung and fix them? There has not been a human being who said yes to that. All these doctors say no. It brings down the load of the infection so the immune system can recover. And during that time, we provide supportive care, which catalyzes the immune system, keeps you alive while you need it. And then you do the rest of the healing. Yet when
Hmm.
we start to talk to our patients as a society of medicine in this globe, we forget that we know the principles. And it's really about, we should be telling about what you are what you eat, like literally a lot of times. And then everything that goes out, it's like, like for me, like a lot of times, like I love having my water with me. And then I tell people when they take their supplement or their medicine, people get so mad. They're taking like handfuls of shit and they're like, oh, I can't stand this. So they're like, they get so frustrated and pill fatigue. I'm like, every single time you put food in your mouth, be thankful for that food from where it came and be thankful for you to be taking that proper, like taking that step towards more optimal health. When you put the medication or you put that supplement in your mouth, don't make it a chore or a negative placebo or a negative meditation, put it in your mouth and be like, I'm so thankful for this being here. And I'm also so thankful for myself for taking this extra liquid thing that like cryptolepis in general tastes like crap, but it's one of the best herbs we've ever seen. And it's better than most of our antibiotics. Be thankful that you're doing that, because then now here, when we go back to our gut, if we're not thankful, when we're more grateful and thankful, we're more parasympathetic, right? Which is all what we're trying to do, which allows us to absorb the nutrients better, digest them better, because when we're parasympathetic, our gut works better. So it's not like I can just I can just clean up my diet if I don't clean up my mental diet. And this is one of the things I do a lot of is like, what are you thinking about all day long? Just for the next hour, just pay attention to what you're telling yourself about yourself. You can
Mm-hmm.
do it all day, but you're not going to have to, because 95% of the thoughts we have in our head are super repetitive. And just go, do you have a positive or a negative meditation that you're saying in your mind over and over? Is your mantra good or is it bad? And if it's more bad than good, let's move it towards something more positive over time, so that our mental diet and our emotional diet reflects what we're doing with our plate. Because I know people who have great, amazing diets. In fact, they go out of the way to be pissed off that their diet is perfect, but they're not better. And I go,
Mm-hmm.
well, look in the mirror. And sometimes that mirror is a recording, right? Listen to
Mm-hmm.
what's going on in here, because if you're doing all the right things physically and not getting better, maybe you're in a repetitive negative loop of self-talk or a repetitive meditation, affirmation, whatever you want to call it. And that's the part of your diet that's off. Because we all talk about food so much, but it's
Mm-hmm.
mental food as well.
So many things that were amazing out of that what you just shared. And something that was coming to me too is a lot of what I have seen and also experienced with myself is when you are living the cycle of like the chronic illness lifestyle where you're eating the bad foods and you're not really sure what you're doing, you're just engaging in the same negative behaviors and patterns. A lot of times people can be like dissociated and more in like this
Mm-hmm.
chronic freeze state that you're talking about. And once you make a couple of changes, like even if you just take some of the crap out of your diet, a little bit less sugar, a little bit less processed foods, that also improves your nervous system and your gut and everything. And then if you just add in a little bit of some more, maybe a meditation or a breathing practice or something, and you start to regulate your nervous system a little bit more, then you slowly start to take yourself from that chronic dissociated state to, okay, now I can actually feel my body. Now I'm more aware of what's going on. I had a talk
Yeah.
with a client today where she was in that dissociated state 6 months ago, and now she's realizing, oh, I'm anxious when this thing happens. I'm feeling irritated when this thing happens. I'm feeling frustrated with when this thing happens. I said,
Mm-hmm.
that is amazing. I was like, that's so cool that you can actually feel yourself now. And you can notice when you put in a certain food in your body that you don't feel well, or this person irritates you. Like you're starting to turn back on your nervous system and get into a more regulated state. And then once you're there,
Right.
you have a little bit more control of things and you can keep going with it and you can start implementing more changes. So I think that a lot of those tips that you just gave
And
are good places for people to start too.
yeah, and one of the things that, as you say, that really comes up for me is that I'm not trying to say that anyone's done anything wrong. In fact,
Mm,
if what I just said kind of pisses you off a little bit, and what Rachel said pisses you off, like I can't do that. That's actually cool. Because the thing is, I want to point out that if you're in that freeze state, or you come, and typically people kind of come in and out of it, right? I mean,
yeah.
it's not like we all live there, but some do. Um, that is actually your nervous system protecting you. And if I can leave you with one thing, well, two things. One is you can get better. Number two is your body is 100% body, mind, and spirit there for you all the time. Now, it may not feel that way, but it is doing the very best it can to keep you alive. And at that reptilian base level of our nervous system, comfort is equivocal to safety. So if you're in your comfort zone and you feel uncomfortable getting out of it, a lot of people will heal really quickly and then they fall off the horse, heal really
Hmm.
quickly and fall off the horse. Well, why, when you're getting the momentum towards achieving the goal you want, do you fall off the horse? It's because it went so fast that your nervous system got afraid and it wanted to protect you. So that's why we have all these different approaches that Rachel and I talk about, where we can move you into a position where your body can more readily accept that change. But a lot of times we just need to change a little less quickly and have realistic expectations. But I hear so many people say my body's betraying me, and I'm calling bullshit on that, because as someone who almost didn't do this and just did critical care medicine, because I just, for some reason, my brain and my body work well in those situations. I love helping people when the most important stuff matters, like your life, either acutely in chronic in the critical care, or chronically in this sense. Like, the thing is, if your body wasn't on your side right now, you'd be completely dead. And in fact, your body will try so hard to keep you alive that it may die in the process, right? Your body's never, ever, ever betraying you. Now, your higher brain may get confused and start making you think stupid shit that will lead to accidental self-sabotage. But a lot of what's going on here is not because you're not trying hard enough. And it's not because of that. But at the same time, because you know your nervous system is protecting you, you have the skill sets and you have access to people like Rachel and myself who can share the ways that you're able to get over that. So you have to take the responsibility for saying thank you to your body, and
Hmm.
then also helping it along, right? Because we have access points to healing that your reptilian nervous system doesn't know about, but your mammalian and then your higher neocortex part of your brain do. So we have to get them communicating again. But at a base level, your body is trying to protect you. So all
Hmm.
this crap that happens to you, your body is actually on your side. So just remember that. It's just such an important thing. So many people feel like completely betrayed by everybody, including their own body. And I'm like, well, your doctor may have screwed you over accidentally or on purpose, like, and betrayed the system may not be on your side all the way, but there's people like us who are, and you are always on your side. Now just allow your body to do its job and take a lot of the information we're sharing and put it into action.
Hmm. Yeah, our nervous system and our body is such a intelligent being that is trying to protect us at all times. And it really is about going at the pace that's right for you. And that's why I loved that you said when you were first healing and you were doing yoga, that 85 minutes of your 90-minute yoga was actually just breathing. And that was okay for you in that moment. And so that's also okay for somebody listening if they're like, oh, I have to do this yoga or I have to do this thing, but then you can only do a certain amount. And so finding that amount for yourself is so important, and giving yourself grace and listening to your body and
Mm.
understanding that it's okay to be in that place and that you can get better.
And I didn't realize it was okay until many, 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 many months later. But what I did know is that the path I was going down over here was the same old one. And if I kept going down there, I was going to get the same result. I just
Hmm.
said, I choose me. I choose the future I want. And if something comes into my life by quote unquote coincidence, which it's not, I've just manifested this, I'm going to go with it. And if it's tough and it's hard, but I resonate with that path that, like, towards healing myself, I'm just going to go for it. And it literally, in the moment, I hated it. I'm at type A super over. I mean, you know me pretty well now. I mean, I like, if I'm not getting it right away, I'm pissed. And it's like
Hmm.
my daughter's like 14. It's like, you could see that in her. It's like she just expects to excel at everything right away. It's all right if it sucks in the moment, because in a week or in a couple months, you're going to look back and go, I am so glad that I just listened to what Rachel said and brought grace into that moment. And then you're going to pick up that momentum for sure. I've seen it happen so many times. I can say it from seeing patients. I can say it from my own healing journey. So definitely, double down on yourself.
Hmm. So, for everybody out there, it sounds like finding the right practitioner, getting the right testing if necessary, and incorporating a lot of different things, mindset changes, nervous system work, nutrition, getting the right herbs. There's a lot of things that can be done that can really help people. Is there a final tip or piece of advice that you want to give people for if they're feeling a little bit overwhelmed right now with that process?
Yeah, I mean, I think one of the biggest things is there are people out there who can help you and love and care about you. The number one thing is, pick one thing that is repetitive in your mind, or if you look in the mirror, that thought that comes up or that weird emotion, just smile and love it. And
Mm,
if the only thing you can do is say, like when I eat food, I'm so thankful for it. I ask people a lot, and whether it's Lyme or some other thing, whether it's Lyme, cancer, COVID, mold, have you loved that today? Have you loved your Lyme today? Because if you go, I fucking hate you,
mm,
everybody now like feels that, right? You feel the constriction. But if you go, Lyme disease, I love you so much. Thanks so much. If there's something that I'm supposed to learn from you, put it on a postie as you go out the door. But I love you, but you're not welcome in here anymore. That difference of contraction versus expansion, give yourself that grace. Or if you have that repetitive thought, give it some space and then reach out. I mean, I train other practitioners. Rachel and I work together to train other coaches. Like, get out there, get someone who can help you along the way. But the number one person who can do stuff is you. And I find the biggest challenge with all of this is people have the ultimate healing responsibility. It's amazing because it's free and it's right in front of you, but it's hard because you have to take that responsibility. Not saying you wanted Lyme or COVID or mold, but you got it. And now it's like, it's not about the steps that were taken. It's what's the next step you take from here. So just pick one thing and just give it some love, whatever it may be. Because once you give one thing love, you give a second thing love, you give a third thing. Now you're changing your day, and it's easy, right? Just something that's bothered me. Oh, I'm going to just love it once.
mm.
Now I'm going to love it a second time and start there. And then it's like the simple, freest stuff. Everyone's like, can I get exosomes? It's like $50,000. Can I get this or that or that? I'm like, why don't you just start by looking in the mirror and find one little uncomfortable thing and love yourself? It's like,
That's awesome. I love that so much. Um, okay, this has been amazing. I know we got to go. We have a freebie with the 5 supplements for Lyme, right? And tick-borne infections. So that link is in the show notes that people can go grab. I think you mentioned some of those in the show today. And then what else would you like to share with the listeners where they can find you and connect with you also?
Yeah, thanks. I mean, the easiest place is our medical practice is originsofhealth.com. There you'll be able to find ways to kind of, reach out to me, some of our social stuff. Also, if you need docs, we have several people on staff who can help in different states. And also you can find a list of other practitioners who have trained with us. So, we're working, getting close to having someone trained in this sort of philosophy of taking the best science and bringing together the art and also that mind, body, spirit piece. And so we're getting close to having people all over the place. So you'll find a list of them there. Then join us over on social media. I mean, the biggest place is we do a lot of work on YouTube. So it's just your YouTube, Origins of Health. And we have all kinds of stuff from deep dives into all the topics we talked today and some healing experiences. And reach out there. Love to have you there.
Amazing. Thank you so much, Tom.